This is going to be a walkthrough video over the Neodent GM Surgical Kit, as well as the Neodent GM Prosthetic Kit. This video is going to be aimed mostly towards dental assistants, but really anybody in the office who wants to learn more about the kit should be able to benefit from this as well. So I will start at the top. These are going to be your drills that your doctor is going to use to basically make the hole into the bone, also called the osteotomy. That's going to be all of these drills on these 1, 2, 3 rows right there. I'm going to start with the very top. This is called the starter drill. Some people call it the pilot drill. You can notice that it's a little pointy on the very top. Your doctor most likely is going to start off with this one. Now the next set of drills are all going to be labeled by the implant that it corresponds with. This is going to be your 2.0 drill, your 3.5, 3.75, 4.0, 4.3, 5.0, and 6.0. Now there's not an implant that's a 2.0, but from 3.5 up, these are going to correspond with the implant width that's being placed. Now, sometime your doctor might stop a little short. Say you're placing a 3.75 implant. Sometimes your doctor might stop at the 3.5 drill, maybe to get the implant into the bone a little bit tighter to get more torque, which is just a measure of how tight the implant is in the bone. That's going to be mostly for all next procedures or even overdentures. But these are going to be your drills that are going to correspond with the implant that's going to be placed, going from your 2.0, 3.5, and so on and so forth. Now, these aren't exactly 3.5 millimeters. It's a little bit less, but again, it's just to correspond with the implant that's being placed. And everything's nice and color coded as well. If you look at this second row, these are going to be called your plus drills. These are going to be drills that are just a little bit wider than the drill that's right above it. Your doctor may or may not use them, but you can tell that it's still color coded based off the implant that it's corresponded with, and it's just a little bit wider than the drill that comes before it. Same thing with these drills here. These are more so for the crest of the bone to prepare it, especially in very dense bones. But again, these are also color coordinated, and your doctor may or may not choose to use these. On this last row, these are going to be what's called the directional indicator pins. I like to just call them the guide pins. These are going to be pins that if you're placing an implant, a lot of times for a single implant, you can use this side to put into the hole, and your doctor can be able to take a PA or any kind of x-ray just to see the angulation of what the implant's going to be. So your doctor may or may not use one of these. I like to use these for single implants, not so much AOX surgeries, but they can be helpful just to be able to get the angulation correct. Again, these are color coordinated based off the drill that's being used. Now with these though, you're going to have one side that's a little bit wider and then the other side that's not as wide. On all 1, 2, 3, 4, 5 of these, it's going to have one side that's thinner, and that's going to be 2.0. And then the other side that's a little bit wider, that's going to be the one that gets bigger depending on the implant that you're using or the size of the osteotomy. So these are going to be, again, called guide pins. Your doctor may or may not choose to use these. Now, arguably the most important pieces in this kit, it's all important, but if there's one that's needed, absolutely needed during an implant surgery, it's going to be these 3, specifically this one. These are going to be the 3 basically drivers. By drivers, I mean the implant drivers. These are going to be the attachments that are actually going to be placing the implants. That's going to be these 3 right here. The difference between them is that this first one is going to attach to a handpiece, and these other 2 are going to be attaching to a ratchet or a torque wrench. This is going to be the one that's going to attach to your handpiece or latch. You can see that they're all going to have the same top, but on the bottom, that's where it looks different. This is going to be attaching to a handpiece. You can see the latch. This is going to be the top that's going to be attaching to an implant. Again, this bottom one is going to be a latch attaching to your handpiece. Now the difference between that one and these 2, same top, still attaching to the implant, but on the bottom, it's going to be a square piece. Because they're square, that's gonna mean that it's gonna be attaching to a torque wrench. I'm gonna put these down here, and what I mean by the torque wrench, which most of us have already seen one, but I'm gonna open this up. The torque wrench is gonna be this piece right here. Sometimes your doctor might start off placing the implant with the attachment that goes with the handpiece and finish off with the torque wrench. These pieces are just going to attach right here, and then it can be used to do the last bit of torquing down the implant. So again, this is the torque wrench. It's going to be in the bottom of this cassette, and these pieces are going to go right here. Last time, these three pieces right here are used to actually place the implant. The first one attaches to the handpiece, while the other two attach to the torque wrench. A few other pieces in this kit. This is going to be your drill extender. Sometimes if there's a hard to reach spot, your doctor might choose to use this drill extender. It basically goes into the handpiece, and then the drill goes into this piece just to make it longer, just to get into hard to reach areas. These pieces aren't used too much. This is a piece that can go into the implant, and then an x-ray can be taken just to see how deep it is subcrestal, or how much, what level this is in relation to the tissue and whatnot. These are other guide pins, but this one's a little bit different, specifically for all-on-X procedures. This one has a 17-degree tilt, and this one has a 30-degree tilt. Again, mostly used for all-on-X procedures, just to make sure that the angulation is correct. And then lastly, this is just a basically used for a hand driver. Anything that has a latch can go into this, in case your doctor chooses to use this to place an implant by hand, or put another piece in here to just use their hand to attach anything to it. The final piece that I'll talk about in this kit, if I open this up, sometimes it can be kind of hard to open, is going to be this probe. Sometimes your doctor may use this after they do the initial drill, just to make sure that they're in a place where they should be, just to make sure there's no perforations in the sinus, perforations in the nasal floor, anything like that. So this is going to be your probe, and again, this is going to come in the surgical cassette.